Hey guys, I'm sorry if you guys hear gunshots in the background. It's because my neighbors are shooting cardboard. And today, in this video, we're going to be doing Q&As of questions about scoliosis. Now these are the most common questions, and common questions that are asked from somebody who doesn't have scoliosis to somebody with scoliosis. So like my best friend, she might ask me one of these questions. So the first question is, who gets scoliosis? Anybody can get scoliosis. Depending on like an infection or an injury, it can cause your spine to curve, and as you like do daily activities, and cause that injury to get worse. How is scoliosis diagnosed? A doctor takes your x-rays, and like even if he's not doing it on purpose, he could like just be checking like some recent surgery that just happened, and he can see the spine curvage, and depending on how curved your spine is, you either might get a back brace or you might get surgery. How does scoliosis have to be treated? What are the treatments, if so? Doctors typically follow patients without treatment and re-examination them every few months when the patient is still growing and the curve is mild. Now for the bracing, doctors may advise patients to wear a brace to stop a curve from getting any worse in patients who are still growing with moderate spinal curvature. As a child's near the end of growth, the indications for bracing will depend on how the curve affects the child's appearance, whether the curve is getting worse, and the size of the curve. The surgery. Doctors may advise patients to have surgery to a correct curve or stop it from worsening. When the patient is still growing, has a curve that is severe, and has a curve that is getting worse. That answers that question. Okay, next question. If the doctor recommends surgery, which procedure is best? Many surgeries are awesome, but I'm just going to read this. Many surgical techniques can be used to correct the curves of scoliosis. The main surgical procedure is correct stabilization and fusion of the curve. Fusion is the joining of two or more vertebrae. There are different ways to straighten the spine and different implants to keep the spine stable after surgery. The decision about the type of implant will depend on the cost, the size of the implant, which depends on the size of the patient, the shape of the implant, its safety, and the experience of the surgeon. Each patient should discuss his or her options with at least 2 experienced surgeons. There are multiple different. I would tell you guys what I'm getting, but I'm not sure. It's like a really long word. Can people with scoliosis exercise? Yes. Yes. Like, yes. Where can people get more information about scoliosis? You can either call 301-495-4484, or you can email their website. things like that. So, and there's also a bunch of websites that you can go on if you want to. iScoliosis.com is a really good one. It's about like stories that people have gone through with scoliosis. Thank you guys for tuning in this video, and I'll see you guys in my next one. Bye.